today are Dr. Karen Salmon, the State Superintendent of Schools, and Dr. Jinlene Chan, the Acting Deputy Secretary for Public Health Services at the Maryland Department of Health. Nearly a month ago, on September 4th, as a result of our early and aggressive actions and our successful mitigation efforts, Maryland was able to safely enter Stage 3 of our Maryland Strong Roadmap to Recovery, and all businesses in the state of Maryland were able to open. Since then, we have continued to see improving trends with our health metrics. Our statewide positivity rate is now down to 2.88%, which is a decline of nearly 90% since it peaked at 26.91% 167 days ago on April 17th. Maryland's positivity rate has now been under 5%, which is the benchmark set by the World Health Organization and the CDC for 98 consecutive days since June 25th. It has been under 4% for 54 consecutive days since August 8th. We have 0 counties in the red zone, which is designated by the federal government. All 24 jurisdictions in the state of Maryland have positivity rates below 5%. 21 of them are under 4%. 14 jurisdictions are under 3%, including Baltimore City. 4 of them are under 2%, and we even have 2 jurisdictions that are now having positivity rates less than 1%. Hospitalizations are down more than 80% since they peaked 167 days ago at 1,711. And we have seen a nearly 88% decline in ICU levels since they peaked 144 days ago on May 10th. We have also seen a continued and sustained drop in the cases per 100,000, which has dropped 55% since it peaked 147 days ago on May 7th. And today, the state of Maryland is reporting 0 coronavirus deaths for the first time in 187 days since March 28th. Earlier this week, we convened the 25th meeting of our coronavirus recovery team, which includes some of the top doctors and public health experts in the nation. We discussed additional measured, data-driven steps to continue to move forward with our safe, effective, and gradual reopening plans. This included steps to help our seniors in Maryland nursing homes return to some sort of normalcy. This spring, for states across the nation, nursing homes became ground zero in the fight against COVID-19. And Maryland was one of the first states in America to issue strong guidelines to state nursing home facilities, to restrict access to visitors, to institute strict infection control protocols, and limit all staff travel in order to protect our most vulnerable citizens. We further bolstered mitigation and suppression efforts at Maryland nursing homes, directing all staff who interact with residents to wear personal protective equipment. And we then launched statewide strike teams, which became an example for the rest of the nation, to bring triage, emergency care, supplies, and equipment to overburdened nursing homes. We were also one of the first states in the nation to require universal testing for nursing home residents and staff. To date, the state of Maryland has provided nearly $102 million in emergency funding for testing and PPE at Maryland nursing homes. Through the bipartisan Interstate Testing Compact, which I put together and announced recently, we have secured 250,000 rapid antigen tests from Becton Dickinson, which will make it even easier to detect any potential cases in as little as 15 minutes, enabling us to quickly screen residents, staff, and visitors. By next week, working in conjunction with our federal partners, All 227 Maryland nursing homes are on track to receive their initial allocations of rapid testing supplies. With our successful mitigation efforts underway, back in June, just ahead of Father's Day weekend, limited outdoor visitation at Maryland nursing homes was authorized. And today, effective immediately, as a result of new federal and state guidelines and our advances in rapid testing, indoor visitation is now able to begin in all nursing homes that are not experiencing a current outbreak or that have not experienced any new positive cases in the last 14 days. In accordance with new federal guidelines, indoor visitation would not be permitted if a local jurisdiction's positivity rate rises above 10%. This new federal policy and our new state efforts allows for more flexibility for compassionate care visits to support residents who need emotional and spiritual support. We've already provided $37 million in state funding for our nursing homes for testing. We will continue to provide our PCR molecular testing for nursing homes. But today we are also committing an additional $6 million specifically for testing of nursing home staff by utilizing our state testing resources. We also want to remind Marylanders that the beginning of fall and the changing weather marks the beginning of the flu season. First Lady and I have already gotten our flu shots, and I want to again strongly encourage all Marylanders to do the same. The flu vaccine is the most effective way to prevent flu disease. To get your flu shot, you should go to your doctor, your local pharmacy, or you can call your local health department. The confluence of COVID and the flu has required a change in our strategies for the fall. Over the last month, we worked to transition our signature lab at the University of Maryland, Baltimore, to allow for the use of a CDC-developed multiplex assay test, which is able to detect both COVID-19 and types A and B of the flu. Our hospital surge team is doing contingency planning for any potential flu and or COVID surge. And to learn more, Marylanders can visit health.maryland.gov/flu. There continues to be broad consensus that getting children safely back into the classrooms must remain a top priority. For many, there is simply no substitute for in-person instruction. 35 days ago, I announced that as a result of our improved health metrics across the state, every county school system in the state of Maryland was fully authorized to begin safely opening for in-person instruction. A month ago, on September 1st, the State Board of Education voted to require the 8 school systems that had not submitted any plan for returning any students for any in-person instruction for the entire year to go back and revise their reopening plans. As of today, all 24 jurisdictions have complied with MSDE requirements and have submitted plans to resume at least some in-person instruction. Dr. Salmon and I also announced last week that all schools are safely able to resume fall sports beginning next week. With the great progress that we are making on our health metrics and with our strong economic recovery, with all businesses open and people returning to work, MSDE has been working hard on plans to safely expand child care. And I want to sincerely thank all of the parents, child care providers, teachers, and staff for their hard work to adapt to very difficult circumstances in recent months in order to keep our children healthy, safe, and learning. And I'll now turn it over to State Superintendent of Schools, Dr. Karen Salmon, for an important announcement regarding child care in Maryland.
Thank you, Governor, and good afternoon, everyone. It's great to be with you all today. Early in September, as the Governor previously said, he announced that Maryland had entered the initial phase of Stage 3, and the week prior, as a result of improved COVID-19 health metrics, we announced that every local school system in Maryland is authorized to begin reopening for in-person learning. Thankfully, our COVID-19 metrics in Maryland remain in a very positive position, and we continue to encourage local school systems to bring students back safely for in-person instruction in light of those numbers. For the last 6 months, capacity limits have been in place for child care providers as a mitigation tool to prevent the spread of the coronavirus. In working with the Maryland Department of Health, we have seen very few positive COVID cases in our child care facilities, likely due to the rigorous health and safety guidance implemented by the child care community from the beginning of the pandemic. I want to also thank the child care providers, the teachers and staff for their dedicated service to our children and families. They are certainly heroes. When the capacity limit for child care programs was increased in June from 10 to 15 individuals per room, the state did not see a spike in cases within child care programs, even as more providers reopened their facilities. At this time, more than 82% of child care providers have reopened. However, with most school systems remaining in a period of virtual learning or a hybrid model, we understand that the demand for available child care remains very high. Therefore, today, I am announcing that child care providers are now able to return to the full teacher-to-child ratios and capacities for which they are licensed. Today's announcement means that child care centers can now serve up to 20 3- and 4-year-olds in a room with a ratio of 1 teacher to 10 students, and up to 30 school-age students with a ratio of 1 teacher to 15 students. Of course, child care providers must continue to adhere to federal and state guidance on health and safety protocols, as they have successfully done to this point. Hopefully, this action will assist in limiting the many unregulated and illegal child care providers that are operators that have sprung up in recent months as pandemic pods, where there are no criminal background checks, no oversight, and parents cannot be sure that their children are in a safe environment. Licensed child care programs interested in reopening may contact the licensing specialists at the Maryland State Department of Education, and parents and guardians in need of child care may contact Locate Child Care at 877-261-0061 or through the Locate website on the Maryland State Department of Education webpage. Reopened programs will receive a one-time grant of $800 for family care providers and $1,600 for center-based child care providers. These grants will be available through October 31st of this year. The Maryland State Department of Education is also providing $1,000 in startup grants to eligible new family home care providers in an effort to bolster new small businesses. We've heard very clearly from parents and providers who have written and called me that we needed to return to licensed capacity to meet the needs of working families and prevent the closure of child care centers once it could be done safely. I am very hopeful this announcement effectively complements local school systems' efforts to bring students back into the classroom and provides working families with more access to safe child care and programs. Thank you.
Thank you, Dr. Salmon. With that, we'd be happy to take a couple of questions. Okay. Nobody has it. I almost got out of here. Yeah, please.
Yes, sir.
Dr. Salmon, can you go a little bit in depth in terms of the child care aspect, especially with some parents who maybe at home aren't able to work, and how are they able to afford some of the child care equipment still?
Well, we still have child care subsidies, so anyone that's at certain income levels is still eligible to receive a supplement that goes right to the child care provider.
So Dr. Chan a question. How should Marylanders interpret the health news here? Because that sounds good, that we have not had a death in 24 hours. But there are these concerns out there. We hear about a second wave. What's the rational approach to this?
Well, obviously, we are looking at and planning for and trying to prevent and mitigate against a potential surge in the fall. But as I mentioned, it's why we push so hard to get the rapid testing. It's why we've transitioned our lab. It's why we're doing, surge planning just in the worst eventuality, because we are, it's not something we're not concerned about. Our health department we're having talks about this on an ongoing basis with a lot of important experts, but we ran it by our whole coronavirus recovery team, and they believe that some of the actions we can take because of our great metrics, we're doing better than most states all across the country, much better than the nation as a whole. I think because of the great work by a whole team of people making smart decisions, and thanks to the people in Maryland who've been really vigilant and listening to all the great public health advice. So I wouldn't say we're not concerned about a potential problem in the fall, but right now our health metrics could not possibly be any better.
Continuing that thought, there is some talk now that this is as good as it's going to get, right, before a vaccine. Continue to urge people to get into school. No new vaccine, not until the middle of next summer for everybody. That's what we've heard all along. What do you say to the continued reluctance of teachers, school systems to go back now, despite your urging? They could be out of the spring as well. I mean, where do you stand on all that now?
Yeah, well, I think there's a difference between teachers and the union, because we've been visiting schools all across the state where teachers are back in public schools and they are teaching kids, and the teachers are very enthused and excited to be back in there with their kids. And I hear from teachers every day who are dying to get back in the classroom. But the union obviously has taken a pretty strong position that in many cases they don't want to go back really ever until the whole thing is gone and until there's a vaccine. That's a pretty strident position. But I can tell you most people in the state do not agree with that position. We're very pleased that because of the State Board of Education taking action and because of us continuing to push some of these local leaders, that they have now all submitted plans to bring at least some kids back in the classroom instead of refusing to even submit a plan. But we still have progress to make. By law, the local counties have the right to make these decisions. They have a duly elected or appointed school board, and we can't and won't usurp their authority. But based on the health metrics, based on both the health department and the State Department of Education, there really is no excuse for not trying to bring kids back.
The weather cooling, outdoor dining is less attractive. Do you foresee any assistance to restaurants down the road as more and more continue to close down, especially in downtown Baltimore?
Well, I'm concerned about our restaurant operators, our small businesses. That they've been one of the most impacted businesses. And that's why we work so hard to get increased capacities and for both indoor and outdoor dining. There's no question as it gets colder, the options for outdoor dining are going to be less. At this point, although in Baltimore City they have not moved along as quickly as the state, most of the jurisdictions have 75% capacity in restaurants. I can tell you that most of the polling shows that a pretty large majority of people do not want to go back and eat inside of a restaurant. So it's not so much a restriction or an order. It's just that, until there's a vaccine, some people are not going to feel safe. And so our health departments put out terrific guidance. They've provided flexibility, plexiglass dividers between booths, increasing the capacity. But we can't make people go back to the restaurants, and we're going to do everything we can to help these small businesses. But in Baltimore City, I think we're going to be losing more than anywhere else because they kept them at 25% capacity, didn't let people inside, and the businesses just can't hang on. So we're encouraging the city to catch up with the rest of the state.
Well, a question for Dr. Chen. In the last day or so, a number of parents who send their kids to private schools have been notified by these private schools of an advisory sent to them by the health department that says that rapid testing in the schools is no longer acceptable. Can you talk a little bit about why that advice and what ramifications, if any, does that have for rapid testing in other congregate settings in the state?
So actually what we are saying in a school setting is that testing as a screening tool for schools, for students and staff is not needed. The CDC does not recommend that in a K through 12 setting. So schools that have been using it may have implemented that policy. When you look at point-of-care testing, one of the things that Governor Hogan is rolling out today, in conjunction with the tests that the state has been able to procure, and in conjunction with the testing equipment and supplies that the federal government has provided for nursing homes, they will be able to use those point-of-care tests as part of their staff testing strategy, the routine weekly or monthly testing.
We still lack a lot of clarity about the lab genomics test. What can you tell us about the investigation into the false positives? And now that the lab stopped using those, what is the fate of the rest of the tests?
So we don't have any problem whatsoever with the lab genomics tests. We have successfully utilized more than 250,000 of them without a single case of a false positive, not one. As I mentioned in my remarks earlier, we had discussions for more than a month to convert our UMB lab, which we built, over to the combined assay test, which tests for the flu, which is, I think, what UMB told you. We're continue to use thousands of them every single day at our other labs, and we're now converting over our state lab to do more of them. All the tests we're providing to these nursing homes and all the things we announced today, the rapid test is one thing. We still have to do the diagnostic tests, and we will be using, for all of those things I mentioned, the lab genomics tests, which we did not have a problem with.
So to be clear, you're saying that the lab genomics tests have no problem?
They're no problem whatsoever. We've used 250,000 of them, no issues. We don't know what happened with those 3 nursing homes. As UMB put out a statement saying it could be any one of 10 different reasons. The collection samples were bad. Somehow, somebody touched something, or they just something that nobody has said there's a problem with the test except you.
So we have about half, the state has about half of those Korean South Korean test labs?
Not quite half. No, maybe about 40%. We've done, I think, close to 270,000. We said we wanted them to last through the fall. Now we're switching. We have new tests coming in, so we now have the flu test, but we're going to continue to use them, and I think through the fall, hopefully, we'll be utilizing all of them.
Last question.
Governor, you had some numbers released earlier this week in regards to the state figures. What those numbers look like to you? They seem to be better than expected. And did you watch Monday night's debate? Tuesday night?
Yeah, what a great, diverse question. Our economic numbers and that debate. That would seem like a twofer there, but. We were very pleased with that our revenue numbers are better than was projected by the comptroller earlier, and it's the good news is that we took some aggressive budget-cutting actions at the Board of Public Works. My colleagues and I unanimously took some actions earlier that will help put our budget in a good shape. On the revenue side, because we were able to keep 70% of our economy open throughout the entire crisis, many states were not. Many had to shut it all down and re-shut it down again. We've had 98% of our economy open since June, and now 100% of all of our businesses. Our revenues are much better. We've added more than 180,000 jobs in just a couple of months. Our unemployment rate is much better than the country, better than most states. That's providing more revenue than was estimated by the Board of Revenue Estimates, which is a great thing. We're very pleased with. However, it does not solve the budget crisis for next year, and there's still going to be about $1 billion shortfall. So it's really good news, but it doesn't completely make it a rosy picture.
Governor, I'd love to hear your answer on the debate as well.
Oh, well, I'm sorry, I forgot the second half. I thought it was a train wreck, and it was just out of control. I could barely watch it. And, it's what I've tried to avoid for the past 6 years, the kind of divisive, lack of civility. It was just a mess. I don't think anyone who was undecided watching that debate could decide, that this is why I'm going to vote for this person or that one.
With regard to train wrecks.
Yeah.
The purple line.
Yes.
The builder has walked off and closed up, made safe the construction sites. The state's taking it over. I've talked to county council members. I've talked to people in the community that are terrified it's just going to be a big empty scar.
Yeah, they shouldn't be terrified. We're making great progress on the purple line. After 20 years of inaction, I finally got it moving and broke ground on it where the construction was well underway. Unfortunately, there were a citizen lawsuit that delayed the project for 2 years, and that cost about $800 million in late fees, something along those lines. The construction firm that was doing the purple line is having some serious financial difficulties, and they've had problems across the country with a number of their contracts. They also are being sued because they've been overcharging other states. They were trying to gouge the taxpayers for hundreds of millions of dollars that we didn't feel was adequate. That's the bad news. The good news is we are going to continue to move forward. We have a whole group of very great construction companies that want to finish the job. The state is going to finish the job. There may be a delay as we switch over, but it's much better than having an operator in there that's not getting the job done, that's overcharging the taxpayers. So we're still in negotiation to figure out exactly what the solution is going to be. I can tell you that I believe that the banks that were ready to foreclose on this operator have, I think, agreed to a forbearance for 30 days, so that their financial situation is not as desperate. We're hoping that, and I think they've directed them to come back and negotiate with us. If there's a possibility of solving the serious disputes with this firm, that's a possibility. But if not, we don't have much more time to waste negotiating with them. We're going to move forward and get it built without them.
That's it, guys. Thank you.
All right. Thank you.